You're watching Byline Wilmington on CBS 10 WILM. Here's your host, Don Ansell.
We're back. Our guest is Dr. Marcia Fretwell. She is a geriatric specialist, a local physician, and we're talking about healthcare and lots of different issues. When we broke, I said we were going to talk about this issue of advertising prescription drugs to the public. When we grew up, and we're generational peers, you went to the doctor, they told you what you needed, they gave you a prescription, you went and filled it, and that's how the process went. Now, the drug companies are advertising drugs to the public. To what end?
Well, I'm actually quite interested in this because there's a particular drug that's being advertised, and that would be called proton pump inhibitors. And that's what people take for gastric reflux, or the reflux of acid into the... Now remember, I take care of older people, and by the time an individual is on Medicare, they have probably given up 75% of their capacity to secrete acid. Okay, by the time they're in my population, which is really like 85 to 95, they have almost no acid in their stomach. And one has to ask the question, why are all of these people on proton pump inhibitors, which is blocking their acid, and what are the larger ramifications of further blocking acid? So what does the acid in the stomach do? Well, it keeps you from, it kills bacteria that get into your stomach. It helps you, but what I'm getting at is the whole advertising.
Is to create demand in the public.
And it's not always entirely honest.
Since when do we go to our doctor and say, I need this drug, and please write me a prescription? Obviously that's working, or they wouldn't be spending, these drug companies, billions of dollars in...
It is working. And at one level, we're in a transition. And my career spanned that transition of the pedestal versus equal relationship and responsibility, okay?
Right.
Doctors on the pedestal,
right.
Patients down on the ground. Right. Now we're all down on the ground, okay? And that's fine, because that means that people are taking more responsibility for themselves, they're educating themselves, but I think you have to be careful, and they're not fully educated at this point about what is always right.
Well, the education comes from the ads the drug companies
That's right.
are...
Who have an agenda.
Yeah.
And it turns out it's really the valve in your lower esophagus that causes reflux, and the acid getting there, but it's a longer study.
Should that whole area be firmly regulated by the government?
I think truth in advertising would be very, very important, and I don't think we've always really seen that.
I mean, should drug companies be allowed to advertise to the public?
I don't feel the need for them to do that. I think there are
who's making these decisions about prescription drugs? Obviously, people are saying...
Well, and it's a similar thing that's come up in medical ethics, bioethics, because when I started 10 years ago on an ethics consulting service, the big problem was patients didn't want to do what doctors wanted to do. In 10 years, it's completely flipped around, and doctors do not want to continue care because they don't believe it's beneficial, and patients are demanding that the doctor, the hospital, and everybody continue this care that is no benefit. So our whole ethical thing is flipped.
Let's flip around some more and talk about another issue, medical marijuana. How does the medical community, do you have a pulse on how the medical community feels about marijuana for medical use, medical purposes?
Not really, because the areas of the country where that's happening are in Oregon and California and Colorado, and the southeastern part of North Carolina is...
Do you think it should be allowed?
Well, I think that...
There are demonstrable benefits.
Yes, there are demonstrated, and it should be allowed. I think I'm coming around, and this is some advice from my son, is that it needs to be regulated, because like cigarettes or alcohol...
abuse can
occur, and the other abuse that occurs is you don't have a lot of the sales within the tax structure. So people are making tremendous amounts of money on it, getting it to people below age, And that needs, and I think making it legal is probably the larger solution here. It certainly has a benefit medically.
Yeah, there's been and here's another issue. There's been a long tradition of medical companies funding lavish trips for doctors to brief them on the newest treatments and advances these companies have produced. Does that still go on?
No.
No, but it used to, didn't it?
It did,
Yeah.
and now it's, we actually are buying our own pens.
Your own pens?
Yes. And you know, there can be some honest ambivalence. Boy, wasn't it neat we didn't have to buy pens.
Was it unethical to fund these trips, and didn't that influence doctors?
I think it did influence doctors' practice. I think sampling influenced. What we saw with sampling was you always started the patient on this trademarked expensive drug, and then it was harder to get them to pay for it once the samples ran out. And so this move to generics was really held up a lot by the sampling process.
Why did you decide to become a doctor?
That's a good question. Why did I decide to become a doctor? I mean,
it was at a time when gender issues were more than they are now.
I think that might have played a role. I started out as a laboratory technician, and the people that I respected, that I wanted to be like, were all men, and we're all doctors. And in fact, I was told very clearly that it was too late at 21
to go for it,
which I gratefully ignored and went for it. But to me, it's a calling. And to me, it is absolutely an amazing privilege of having a relationship with someone that you could have the chance of healing them and helping them move on in their own personal growth.
I'm always fascinated by how doctors and other medical professionals insulate themselves, or do you, from the emotional side of what you do, like when people are suffering or when you lose a patient. How do you deal with that?
Well, I made a decision very young, actually. I was taking care of a 21-year-old who refused to have a bone marrow transplant from an identical twin. And if you don't think there was an outrage in the center of bone marrow transplants about this young woman, and she told me that she really was not meant to be a sick person, and her life, she'd lived it, and she died, and it was absolutely an amazing thing. It took me months to come back, and I think I went into geriatrics because I wanted to remain open to suffering and death, and yet I needed it to make sense. And it made a little bit more sense when people were dying at the end of their lives than when they died. And I agree for how people do pediatric oncology, but you know, even children do a great job of coming to terms with their death if we let them. So I think I remain open emotionally, and it's been a challenge.
Must take a toll.
Well, I think I've grown.
We're out of time.
Okay.
We could talk about this and maybe come back and talk more
Sure.
as the issue continues to unfold. Thank you for joining us. If you want to see Byline online, go to WILM-TV.com. I'm Don Ansell. Have a great week.
You've been watching Byline Wilmington on CBS 10 WILM. Join us every Sunday morning at 11 as we explore the issues that concern you.